think we should just start our webinar. Hello, everyone. Welcome to the fourth session of EMSA's Public Health Webinar Series. My name is Saifli Ahmed. I'm the Public Health Assistant for Climate Change and Health Issues. And together with the Public Health Director, Rana Orhan, I'm working on a clean air project in collaboration with the European Public Health Alliance, EFA. That's why today's session will be about tackling air pollution during and after the COVID-19 pandemic. Our guest speaker is Zoltan Masai Kosubek. I hope I pronounce your name correctly. He's from IFA, and he will tell you what you need to know about the air we breathe every day. Before I give the mic to Zoltan, some announcements I have. You can ask questions in the chat throughout the session. After every part, of the session, some of those will be answered. And this session is being recorded, so afterwards you will receive the edited version and the minutes. And all mics will be muted from our side, but please turn off your camera as well so we don't have any interference, and make sure your mic isn't accidentally unmuted. In the registration form, we ask you what you thought was the most and the least effective ways to tackle air pollution. And you believe that the most effective way to reduce air pollution on city level was reducing traffic, and the least effective solution was reducing agriculture. I think that's quite interesting to know, and Zoltan will explain exactly how all of that works. And if you have any notes on why you thought one was the most and one was the least, just let us know in the chat and maybe we can discuss that as well. That was everything from my part for now. So the screen is all yours, Zoltan.
Thank you very much for the opportunity and for the invitation. It is always a pleasure to talk to you. That also reminds me when I was a student. Maybe just a few words about myself before I start sharing my screen. So I'm a Hungarian qualified lawyer, and I worked in the Ministry of Health previously. So since 2008, I am in the public health policy field from a legal, so not from a medical point of view. And I was involved in the Hungarian EU presidency. But when I moved to Brussels 2012, I joined EFA, the European Public Health Alliance. And since then, I am a so-called public health advocate. So just a few introductory words. And I hope you can see my screen where my presentation is there. But take it as just a background, so it will be just really a couple of slides. So what I would like to discuss with you, that how is air pollution as a public health challenge is linked to the climate crisis, and the entry point we assess it is traffic and city, and I try to explore a bit, hopefully in a clear and understandable way, how those topics, air pollution, the climate emergency, and the COVID-19 situation currently are bound, and what can we and you as health or future health professionals to do about that. So that's my ambitious aim. And with that, basically, I would like just to go through the structure. So what I suggest is that I talk first about my organizations and why we as IFA speak about air pollution, and then we can go through the different topics. So if you hear IFA or European Public Health Alliance, you should think about a Brussels-based umbrella NGO. We are there or here in Brussels to improve EU policy, EU health policy, and we advocate for better health. There are two major components of IFA. The one is that we are, sorry, I think I just accidentally skipped a slide. So we are a network of various organizations. We have two basic type of memberships. We have European member associations, national member associations, and as you can see, EMSA is one of our members, and so that's a typical example for European organizations. That gives us our strength, because when we advocate, we use the expertise, knowledge, in your case, the energy and the initiative of our members, and we consult our actions with our members. But also we have direct members at various countries at national level as well. I forgot to mention you that I am doing that from home, and that I can be invaded at any time by noisy children. So just please apologize for that inconvenience. Going back to the membership, we are a wide alliance, so we represent not only healthcare and future healthcare professionals, but also disease-specific group, patients, organizations working on risk factors like tobacco, alcohol, but also organizations which are not health organizations, so representing various groups like the elderly or children. And the reason is that they all have an interest and stake in health. So maybe with that introductions, let's move to the area of health. So basically, the reason why we speak about air pollution, you have to understand that if you would like, so you work in the public health field, there are usually key risk factors, 5 big key risk factors: tobacco, alcohol, unhealthy food environment, physical inactivity, and air pollution. And for a long time ago, we only focused on the 3 And why our attentions turned to cities is exactly because of the climate crisis, and more recently the COVID-19 situations made it visible and tangible for our community, like air pollution as a key risk factor. To demonstrate that, you can see here that poor lady. That is a capture taken from a video which we made in our previous campaign 2 years ago, when we wanted to demonstrate what are the health impacts of air pollution. And there are many pollutants and many sources of air pollution. As Saif said in the beginning, agriculture, industry, household heatings are also equivalent contributors, but the fourth one is traffic. And there are some pollutants like particulate matters or ammonia coming from various sources. Nitrogen dioxide is the one which is attributed to transports, and the more specifically in diesel. And if you look at the same screen I can see, you can also see the YouTube link. So afterwards, when the presentation is shared, you can just click on that. So here it is a plastic example, very specific diseases you must be familiar with, linked to air pollution. And just to make clear that it is not only respiratory diseases, it is cardiovascular diseases. So it affects basically every cell in the human body. It affects all organs. So various diseases, and this is just one pollutant. And while air pollution, as you know from your studies, affects everyone, but not the same way. There are some people, chronic disease patients, the elderly or children, which are more vulnerable than others. So this is a serious public health issue. Air pollution itself is a big enough risk factor. The evidence is robust and clear on that. And it is not only a national and European, but also global health challenge. So there are many, many reasons for us, for public health advocates, to prioritize and to work on that. Then moving to the present, so it is bad enough itself, but when we witnessed the COVID-19 situations, it became even worse. So the capture, you can see it is from our website. So when you go there, then you will see the same, and then if you are interested, then you can go details. What I would like to address here is just what are the so COVID-19 and the whole pandemic is a serious issue, but we identified various ways it is linked to air pollution and physical inactivity specifically. The one aspect, maybe that's strangely enough a positive one, and I will talk about it later a bit. It is how the counter reaction to the COVID-19 epidemic, the lockdown measures impacted air quality. And as you so it had two impacts, so two main impacts. First, it was an unsustainable way of shutting down transport and industry activities in many areas of Europe and globally, and it turned out to have less pollution on the street. That was one aspect of it. The other aspect is that people were first to stay home, which obviously meant, I will not talk about the bad impact on mental health, but obviously less physical activity. So that so it's a bit like so it was a controversial impact, and then some of our actions demonstrated here aimed to allow people to move. So we encourage cities to open up parks and temporary bike lanes to make possible physical activity despite the lockdown measures. So that was one particular aspect. But then going more to the medical side of it, I just spoke and demonstrated before the link between air pollution and various conditions. If you look at the death rates witnessed in various countries, there is almost everyone, or more than 90% of the fatalities had one conditions. So that and those conditions are also linked based on evidence on air pollution. So in other words, air pollution did damage, did cause chronic conditions, and then when the COVID-19 hit, indirectly it increased because some people had those conditions because of air pollution. And that's, so here the evidence is clear. So that's one serious aspect of it. The other aspect of it, where we are a bit step behind as regards certainty, is that looking at previous coronavirus cases, the way how, and maybe that's an area you know much better than me, or you will as you learn this, it affects our immune, previous researchers in other coronavirus cases and in the case of flu demonstrated that air pollution weakens your immune system. So if you suffer from a disease like flu or another coronavirus, and you are exposed to air pollution, it prevents your body to fight effectively. So your immune system will go down, and that obviously that can be lethal. However, it is although very likely for COVID-19, because this case is new, it is not proven yet, but it is very likely. So we can also communicate confidently about that. And another aspect I would like to mention here is that if you look at the cases in America, it is demonstrated for Black people, but I am sure it will come out later also that most likely more people so more poor people are suffering from COVID-19, so they are overrepresented in the cases. And one of the explanation of this could be that usually those people, disadvantaged groups, are more exposed to air pollution, or at least that's one of the factors. And then that might be one contributor to explaining the inequalities, the health inequalities as regards COVID-19 cases, and air pollution plays a role here. There are articles, studies published on that topic already, so that's also we witness. So I don't know, maybe we can make a short break in us. I don't know if there are any questions, but that was a kind of thematic block. I hope it was understandable enough.
Yeah, I was actually wondering, because in the previous slide about nitrogen oxide,
yes.
you said that when it comes to traffic, that's the biggest pollutant on city level. But most often when you look at debates, it's mostly about carbon dioxide. So I was wondering, how does CO2 relate to health on city level, and if not on city level, on what level should we expect CO2
Yeah.
to have
So
influence?
thanks for that addition. Actually, that brings the topic to the climate context, because CO2 is considered as a greenhouse gas. It is not a major health pollutant. So this is not which is directly causing diseases. It causes the climate crisis. It contributes to that, and the climate emergency then has many, many bad impacts like heat waves. So that's just the starting point. If you look at air pollution and CO2, the common aspect is the pollution activity, and that also which binds, so which offers a solution. If let's, and that was also the case with the lockdown measures. If we stop or reduce pollution, like we don't use a diesel car, then we prevent the emission of nitrogen dioxide, which can then avoid those diseases, and that also can save costs. And it can also result less CO2 emissions. The other difference is, a fundamental difference is the location. It doesn't matter where CO2 is produced as a greenhouse gas, it will find its way to the atmosphere and can damage the climate. Whereas nitrogen dioxide is basically harmful if people are exposed to it. And that's why the city level is relevant and dangerous, because if continuing the example of a diesel car, if it emits NO2, then it emits it in the cities when we are walking, we are biking, we are breathing maybe at an increased level, and that causes harm. So localizing or reducing the NO2 emissions can help immediate health benefits, while reducing CO2 emission, it's less linked directly to the human body. I don't know if that was clear enough.
Yeah, that's really clear. If anyone has questions, you can just ask them right now. I think I don't see any, so I think we can go on with the present. Oh yes, of course, Sriji.
Yeah, that would be me. Thank you. I have two questions. The first one being when Mr. Zoltan said that with the lockdown measures being taken place, people tend to stay inside, and that leads to less physical activity, and that the parks and other such recreational spots should be opened for a bit more of physical activity. But then on a scale of priority from a medical point of view, I think COVID-19 is a much more serious issue than obesity or lack of physical activity or something like that. And my second question to you, sir, is that I noticed that you said underprivileged people are a bit more prone to um, breathing in air that is less pure or something along the same lines. But I don't understand how that's possible, because we all breathe the same air and we all live in the same cities and air keeps moving. So if you could answer those two questions, it would be great. Thank you.
Okay, with pleasure. Concerning the first aspect, we are in a very sensitive or serious situation as public health professionals, advocates, when we talk about COVID-19, because you are right. It is the pandemic, and the first priority should be to fight the pandemic. So that's why lockdown measures or limiting contacts was never questioned. And this is why we had to be very cautious. So what I was saying, it was an initiative coming from researchers, and obviously it is also messaging. So we, on the one hand, we said respect government measures, stay at home to avoid infection, and that should remain a priority. But at the same time, because it affects the whole population, and people have to move because they have to go at least to the shop, and while respecting the physical distancing, it is possible both keep keep the medical measures necessary to prevent the spread of the pandemic, while paying attention to the importance of physical activity. And then here, it is also, so if you, the call included research, if you exercise, you bike, or you walk, that also increases your immune system. So in that sense, that also a tool to fight the pandemic. And what we wanted to make sure that you can implement lockdown measures plainly, and you can do it in a way where you still keep the public health benefits, but also attach to them additional benefits. And that's what is summarized in the letter we disseminate and promoted. So it's a bit like in between. I would like to add, we face a very similar situation about public transport, because when we are discussing air pollution, we are in principle against private car use because of linked air pollution, and in principle we in favor of public transport. But now we cannot say people that don't use your cars, I'm simplifying, and use public transport because of the COVID-19 situation. So that's another challenge linked to the one you mentioned. So we have to careful and develop our positions to reflect the complexity of the situation. So that's yeah, hopefully clarified a bit. About the disadvantaged group, yes, we live in the same city. The air and pollution moves, but I said about nitrogen dioxide that for health pollutants the location counts, and there are less advantaged parts of each cities when it is a bit crowded, it is closer to big streets, it is very noisy, and obviously if houses, flats are cheaper, and some people can afford that. So the link why it makes poor people more affected by air pollution, that they tend to live closer to busy polluted roads, because simply those are less favorable and cheaper options. So this is why the research points out that aspect, and that was the case even before COVID-19. So it is location and linked to cities, to cut it short.
Yes, I don't see any other questions, so I think we can go on with the presentation.
So I just spoke about air pollution as a public health challenge, and try to explain what are the links it is linked to COVID-19 and the measures they were imposed. And I would like to remain a bit on the same line by showing you this hopefully interactive map. Yes, so it is really showing. So again, it's also an example for advocacy. So what we were doing in March, this is a satellite image, because satellites are able to capture the level of nitrogen dioxide on the surface. And what that plan demonstrates is what were the nitrogen dioxide limits in 2019 compared to 2020. And that was in the middle when lockdown measures were implemented. And that was quite important for us in a sense to visualize that. So you can see the hotspots, Northern Italy and Western Europe, and it is clearly, and we have various pictures on that, so also on city level and also globally, but it is quite plastic and visible how less pollution is there. So that was quite interesting, and that's also unprecedented to some extent. It started in China. Maps in China has a similar tendency, and so it shows two ways. The one, two important conclusions. The one is that the reduction of nitrogen dioxide is linked to urban areas mainly, so basically to cities, because lockdown measures impacted cities. Most people live in cities, and nitrogen dioxide is linked to city level air pollution. There's also an interesting remark that some parts of Europe were not affected. Interestingly, it is the case in the UK, where even and also increased a bit, and also Central Eastern Europe, where there are also potential other contributing factors, or at that point the lockdown measures were not effective. I also wanted to highlight that the European Environmental Agency started since then a weekly monitoring where you can select a country, pollutant, that it demonstrates that. As regards the lessons learned, it is also clear that this is an unsustainable way. And when we are speaking about that, it is not true anymore. So it was a publication of yesterday. You might have noticed it, that basically as lockdown measures were eased, pollution is went back to pre-COVID-19 levels. So what we feared and we warned in our messaging at that time, it became a reality. So now there is a tendency that we are going back to business as usual. So that's something we have to address. But the reason it is good to recall that map is that it demonstrates that reduction is possible. We just have to find a sustainable way to do that. And basically, that also brings to the future and to the present, because when thinking about the situations and finding ways how IFA and the public health community can act on that, I was also thinking of you, health professionals and future health professionals. And with that, I wanted to give you at least some ideas or pillars what can be done. So if you look at the first, it is, and the SAFE mentioned in the beginning that one of the options offered was international, so international activity, so acting on air pollution at international level. That that picture is showing those air pollution bubbles where the different air pollution conditions are replicated in a harmless way in those bubbles, and that was in Geneva when the conference was organized about air pollution and health pre-COVID-19 times. But so we should bear in mind that air pollution is linked to the climate crisis. NO2, PM, and greenhouse gas emissions are having the same sources, and if we close them, then we improve both public health and mitigate the climate crisis. And that cannot be done at European levels. It needs global efforts. The Paris Agreement as an international treaty can be seen as a global health treaty. And the more health we have in the climate, the better. You have heard the Healthy Recovery Initiative facilitated by WHO, where healthcare organizations and health professionals were calling to act on air pollution. So maybe that's also a way for you, also as health professionals, to speak about that at the global level, like signing petitions, following the global agenda. There will be plenty of options like this. The second pillar I want to mention is exactly city level when we are discussing. And we are in the middle of the COVID-19. After the lockdown measures, maybe a second wave is coming. So it is a really exciting and important time when things can be done, which wouldn't be necessarily possible in other normal times. And that's why it is more relevant than ever to have safe and sustainable mobility, safe and active mobility. From a public health point of view, walking and cycling should be an option and a priority. But I was touching upon that we have to address the car fleet because some car use will be necessary. And here, I think the electrification, so closing down the internal combustion engine, saying goodbye to diesel and petrol cars, and then moving to electricity should be one important part of the solutions, a part of walking and cycling. And we have to find a place for public transport because we cannot afford not having a public transport, and especially if you look at the chronic disease patients, the elderly, some people will not have other options than the public transport. So that's why it should be also there. And last but not least, and this is a tangible element, we are basically about to launch a campaign, and we would like to galvanize the healthcare community in every country in Europe. This is a campaign we are calling Medics for Clean Air, and this is where also, so we are quite excited about that, and that will be launched soon. So in case you are interested, just follow us, because that we would like to pull together various healthcare professionals, doctors, nurses, researchers, but that's the campaign is called Medics for not doctors. So we are also counting for future healthcare professionals. So it is not only relevant for now, but also for the future. So maybe that could be also something interesting for you. So yeah, and as a public health advocacy organization, so we try to work on the narrative, but also act and contribute to the debate as much as we can. And I have to admit, EMSA is one of our key partners and the core IFA member organizations who is supporting us in this.
Yes, thanks a lot, Zoltan. I had actually a question again about the previous slide, because you said about the impact of the lockdown on the reduction of nitrogen oxide. So I was wondering, have you seen any specific? Now I'm going to phrase it another way. How is the debate on European level being affected by the results of the lockdown? And do you think the European Green Deal will be more ambitious because of these results?
If I will start with the second part of the questions, the European Green Deal will be more ambitious. So it was a package. I have to admit it was quite ambitious compared to what we were expecting. We were expecting no measures at all, but it was prepared in December 2019. So it reflected the pre-COVID-19 situation. So when the COVID-19 situation hit Europe and the world, and so the European Green Deal has been rethought, some elements were postponed, but because of the situation, and so it will be stronger. So that's already a positive sign. However, it doesn't mean the good enough. And we still think that European decision making is still very far from the public health agenda. It is still not prioritizing population health. It is still much focused on economy. And when we discuss lockdown measures, the main worries were exactly that, how it impacts the economy. And it is valid to some extent, because if you shoot down economy, or if you improve air pollution involuntarily, that's clear. But that's not a sustainable way forward, and obviously you don't want to lose jobs like because that can also create another public health crisis. But we have to understand that we cannot just continue like this. We cannot have a high level of aviation and flights. We cannot afford that high level of transport. So the role of Europe is to recognize that. And the more they hear voices from our side and evidence, and if what we are saying it will make sense, then yes, European policies can be improved. So what you can see here, it affects countries, regions, cities, where nationals can relate themselves. So that's a clear thing. But there is a role for Europe. They have to create, we call it an enabling policy environment, so they can dedicate the funding in a way to support that green and sustainable transitions. They can design the funds for cities. There is many policy and regulations about road safety, about urban transport, So that's, sorry, I'm just, as I said, I am invaded.
Wir müssen ein kleines Französisch will, ich will ein kleines Französisch will den Computer gucken, nicht den echten Fernsehen, weil da haben wir schon alles.
Thank you, Zoltan. I think
People.
your son or daughter has a question as well.
Yeah.
Is there anyone else that would like to ask Zoltan something? Yes, Sila, please go on.
Hi, I'm Slav from Turkey. We know that 7 million people in the world lose their lives due to air pollution every year. Researchers show that about 3 million of these are caused by indoor air pollution. And I'm sure that being indoors in the lockdown process has affected this. I'm wondering your view, and are there different solutions that can be made in this regard? Or do you think enough research and work is being done on this issue? I mean, indoor pollution. Thank you.
Sorry, I was just muted. Yes, thanks for the question. So when we talk about air pollution, we clearly mean outdoor air pollution, so ambient air pollution. And indoor air...
Die Jungs, was haben die geguckt?
Nem tudom, beszélj meg vagy. Sorry. So indoor and outdoor air pollution are both affecting health. And as I said, I have to admit, we focus on outdoor air pollution. If you look at the impact of lockdown measures, what they did result, they forced people to stay home. So in that sense, if when we were home because of lockdown measures, that does not deteriorate the indoor quality in our houses, because pollution is indoor pollution is also comes from outside, and the outside level of pollution will drop down. So we are not aware any bad or deterioration of indoor air pollution because of lockdown measures. We were witnessing overall reduced outdoor air pollution, which did not deteriorate the indoor pollution. So yeah, so in that sense that yeah, so that's one aspect. But once it is we are moving ahead, pollution levels are going back, and we are where we were before, when we could start worry again how the indoor air quality in schools are, for example, because there were pre-crisis measurement in some European schools demonstrating worrying indoor pollution. But the way how we can address that is to address the cause, the root, the source of those pollutions. And just again about schools, it is relatively easy. It is mainly transport, polluting buses and parents coming to the and other traffic around the school. I don't know. I hope that answered your question.
Thank you very much. It was a very good question, Sila. Is there anyone else? We still have some time to answer some questions if anyone has them. Yes, Srijit, you can ask your question.
Yes, thank you. Yeah, I have one little question. With everything going on, we have to sort of dispose a lot of personal protective equipments in the hospitals these days, and usually that's done by incineration. And then there are also rising concerns with the pollution that incineration itself causes. So are there any other possibilities of probably processing the PPEs, like how it's being done in Canada and in the United States right now? Is there a possibility to sort of make that happen in Europe? Because incinerating protective equipment after we use it is not the solution right now, because we're already running we're like at a lack of equipment already. So, and incineration itself causes pollution. So would you like to address that question?
Yeah.
Thank you.
Yes, thanks for the question. If I understand correctly, it is not only about air pollution, but also about how those use of those equipments contribute to pollution, and then that's also a public health issue. Maybe the first thing I have to say about those personal protective tools, equipment, that they are meant to protect or address the pandemic and not air pollution. And that's the fault of many campaigners, including myself, committed in the past, that we used, plastically speaking, masks as a campaign tool to demonstrate against air pollution, whereas this is wrong. Masks can be used and interpreted in a pandemic context and not against air pollution. To put it in other words, air pollution cannot be stopped at individual level. Yes, there are some masks which filter pollution, so they can give you some way of protections against air pollution, but this is clearly not the way to go, and the public health added value is still discussed. So just that statement or additional explanation at the beginning. So if you look at those personal equipments, how they are regulated, and what can we do with that, against a bit like that. So I think what is led by regulators, decision makers, is how to address the pandemic, how to protect, ideally speaking, hopefully that's what they are thinking, how to protect people and the health workforce specifically, and that's the main driving factor of their decisions, since any other factors, I think, come later. Those topics can be regulated to some extent at European level, but here the national legislation plays also a role, and maybe that's also a good question, because it also points out why a joint European approach regulations would be needed. And because of competence issues and reporting delays, the European agency, CDC, and could not regulate or find the solutions to those issues. But so that's also something that is on the table. Again, it is not necessarily from an air pollution perspective. It is more from the COVID-19 and what are the lessons learned. So that can be also one of the questions which should be addressed. And that is sad, because now everything is fluid. The health competencies over at European is open. There can be new legislations. There can be new measures, new projects, how hospitals operated. So there can be space for addressing that problem. So, but I guess that that is, and when any European legislation is developed in the healthcare or other area, obviously examples of Canada and US are taken into account, not necessarily implemented, but they are also considered. So what I can say is, there is an opportunity, but someone has to take the lead on that. And I think maybe this is an issue worth to think about. And then organizations like mine, but also others, can bring this forward in case that there is an interest for that.
There's just like space for one more question if anyone else wants to ask Zoltan something. Yes, Sela, you can have the last question.
Yes, clear. Thanks for your response. But I wondering that in these days, filtration systems are not available due to pandemic. but it also affects accumulation pollution in indoors. So I believe that in this issue, there should be more resource, maybe technological resource. And addressing this issue, I mean indoor pollution, will be more effective about making awareness. And what we can do about this issue when we make awareness. Thank you.
There are various policies targeting indoor pollutions. One is energy efficiency. So in the framework of, and there is a European legislation on that. So when you regulate that, you give incentives, you foresee how buildings should be renovated, and that opens whole new policy areas, how many buildings are old, many. So when we renovate, then obviously energy efficiency is one aspect, isolating them, but replacing the windows, it's another key aspect. And when you are talking about that, then indoor pollution comes in, because then those are usually the doors and windows when pollution comes in. So that specific legislation is one way to address that. And there are also, we call them sector-specific legislations, which are covering like boilers and any specific devices which are linked somehow indoor or outdoor air pollution. We collected them, by the way, in a clean air briefing when we analyzed the situations, and we try to provide what are the European directives addressing specific devices. So here, depending on the exact regulation, sector-specific legislations can be chosen. And the third answer or option, obviously, Europe or not all topics can be regulated at European level for many reasons. There is no political will for that. There is no significant example. But one way European decision making is working, if you regulate at national level or at city level, depending the circumstances, because there is a competence to go beyond what is the EU achieved. If you, as a member states, justify for public health protection reason, you can justify why you introduce stricter measures in a given technical field. And sometimes there is a consultation period for that. Other member states can criticize or say you are not allowed to do that because you affect the internal market. But if it passes that test, then stricter regulation can go at national level as well. It is not an example of air pollution, but banning of trans fats is a good example for that. It was a very specific trans fat, harmful for health. Some EU member states banned them, and then later on the EU analyzed the situations and came forward with a EU-wide regulation having the same impact. So basically it widened the ban. So that can happen also in other fields.
Yes, thank you very much. I think those were all the questions for today. If you have any other questions, please contact us. We can send them to Zoltan and then send those answers to you later on. Thank you very much, Zoltan, for the session today, and everyone else for participating and asking your questions. It was a very interactive session. And as you said, Zoltan, air pollution can be tackled, and we as future health professionals can be a part of that. And I love it that you have changed the name to Medics for Clean Air, so everyone is included in this battle against air pollution. As I said in the beginning, the session is recorded and the edited version will be sent afterwards together with the minutes. If you're also interested in the previous sessions of our webinar series, please contact us. The email address has been shared in the chat. And that was it for today. I would like to thank you again and have a nice evening.
Thanks for the opportunity. Have a nice evening.
Bye-bye.
Bye.